What do you think that this result and the gap is because of the knowledge or the exam strategy or the stress in between? Why do you think that there is such a persistent gap between the students who appear for FMGE and those who clear it?
Knowledge gap, theoretical knowledge gap may not be so much. But there is a problem of application of that theoretical knowledge. Now somewhere down the line, I feel 30% is knowledge gap. 30% is the application of the knowledge to clinical scenarios and conditions. 20% is strategy and 20% is stress.
What message would you like to give to the parents of these students, foreign medical graduates who are struggling to pass this examination?
My first thing is, I'm a very strong believer of what Winston Churchill said once. Winston Churchill was asked to come and speak on the stage in an alma mater, that what lesson would you like to give to the audience? So he got up, he went to the stage, took out a piece of paper from his pocket and read one thing: try, try, try again, and said.
Hello and welcome to the official YouTube channel of Rus Education, where we bring expert voices and stories shaping the future of medical education. I am your host Priya Malhotra. In today's episode, we will discuss about the FMGE June 2025 results. In this attempt, almost 79% students have not qualified the screening examination. But is this telling the truth? Is it the real story? What the next holds in the coming days, and what are the future implications of the next coming in? We will discuss in today's episode. And to discuss it further, we have with us Air Marshal Dr. Pawan Kapoor, one of the medical education experts. With Sir, we will discuss about the results, what made this gap applicable, what are the resistance coming in to the next examination, and what should be the strategy and what should be the changes in the pattern of foreign medical graduate examination. So stay tuned.
Okay, see, before we go to this gap, let us understand how this gap has progressed over the years. If you see around 2014, the pass percent around 4 to 5%. Gradually it increased to 10 to 20%. Then it peaked somewhere in December 2022 to almost about 39 to 40%. And then last year, if you see, we had around 20% pass percentage in June, around 30% in December. Now again this year in June, it has come down to around 18 to 19%. So on an average, you will say around 20% or 25% will possibly clear this. Why it happens? You see, it happens because there is a cumulative effect. People who come in and who do not qualify, they continue to appear, increasing the total number of people who are appearing years after years, because there is no at present limitation on the number of chances. So all that backlog keeps on happening. Some people appear now just for the sake of appearing. They do not prepare, they just go and appear. Other people who come in from the fresh batch, they are the percentage that should tell us, is there an actual gap or the gap is actually reducing. Very difficult till the time you don't get the actual percentages of the fresh batches. To my mind, earlier on, if you remember, before 2018, there was no embargo except 50% marks. Anybody could go and do medicine abroad. After 2018, the embargo came of at least having qualified NEET. My assumption and perception is thereafter the batches started getting passed out from 2023 onwards. Their pass percentage actually gone up, because they are the people who are actually taken seriously their studies. You see in NEET, 24 lakhs appear. Do you think all 24 lakhs are serious?
No, never.
They all just go and appear for the sake of appearing in an examination. हो गया तो ठीक है, नहीं हुआ तो कुछ भी नहीं. ऐसे ऐसे बच्चे जो निकल जाते थे वो चले जा रहे थे। इसी तरीके से FMG में होता है। Those people who had appeared much earlier, who were non-serious about their studies, they continue to appear without adequate preparation. And therefore this gap keeps on increasing. So this gap doesn't actually tell us about quality of medical education. It tells us about those non-serious versus those serious. So if we had data that told us how much percentage of fresh students have passed vis-a-vis how many old students, that will give us clarity. To my mind, almost nowadays from all the universities that we have been associated with, their pass percentage in the first attempt has been around 50 to 60%. And I saw a video where one of the deans of I think Orenburg State Medical University stated that first attempt their pass percentage is around 50 to 60% and 80% of all that batch passes in their second attempt, and he said the remaining 20% will never pass. Now these 20% were added on over the years and increased this gap. So I think that proves my point.
Okay, thank you, sir, for explaining this so well. My next question to you is, what do you think that this result and the gap is because of the knowledge or the exam strategy or the stress in between?
Let's take all three factors, but let's say what is the proportion of each factor. Knowledge gap, theoretical knowledge gap may not be so much, but there's a problem of application of that theoretical knowledge. Now somewhere down the line, I feel 30% is knowledge gap. 30% is the application of the knowledge to clinical scenarios and conditions. 20% is strategy and 20% is stress. Yes, there are ways and means by which you can overcome them, and there have been programs that are being run for FMGs in liaison with several hospitals also to improve their clinical experiences. But to my mind, if you put knowledge and clinical experience and application of the knowledge, this is the major reason of the gap. Second is the strategy. Some people study hard but do not study smart, and stress, it will be there irrespective how confident you are, how well prepared you are. The stress does have a role to play. And
the stress, I think it increases with the number of attempts.
Yes,
is it?
It is very true, because you're losing on time. You have spent almost 5 to 6 years passing out of MBBS, getting a degree. Now you're spending more and more time to pass this examination. Then you do your internship. Then probably you like to go for postgrad. So you're actually losing time, and every time that you appear or reappear, the stress levels definitely go higher. So while your knowledge gap will start coming down, but your stress levels start going
up.
And that definitely impacts your performance.
Thank you, sir. And moving ahead, another, I think, little difficult question. Do you think that public perception of these foreign medical graduates is unfairly shaped by this examination and the statistics of the results?
It's not only public perception. I actually surprised many educated people. Many people who are actually governing the medical education in this country share the same perception that this test is the ultimate let's say standard or gold standard for assessing the quality of foreign medical graduate. It is totally unfair. It is not so. See, I have been associated with medical institutions in this country. I have visited several medical colleges. I have seen how I have myself been a student. I know what goes on, and I have visited a lot of foreign countries, including Russia and Caribbean countries, where the methodology of teaching, where the quality of teaching, the infrastructure is almost similar and maybe at times better. So it is not correct to presume and assume that the quality of FMGs is at a lower standard than our country. It is not true at all. It is very unfair to them. This test is not a gold standard. The gold standard is how does he adapt to the healthcare delivery system? How does he perform in the healthcare delivery system?
True.
There is only one difference: the clinical profile of patients. Now, this clinical profile of patients will obviously vary from country to country. So, for them to come and adapt to this clinical profile, there are issues. They face these challenges. But it is unfair to say that they are at lower quality. Definitely not. They are at same level, and we should not demoralize them by stating this. And this is one of the reasons that FMG always feels himself demoralized because of these perceptions persisting in our environment.
And this is adding to the pressure.
This is adding to the pressure that I am not good enough. I think this is unfair.
Okay, and as we are assuming that next may come in the coming years, so do you anticipate that this perception may change once the next is applicable?
You see, I can only make an educated guess at this point of time. When national exit test comes, it will be common for Indian graduates as well as the foreign medical graduates. Obviously, it's going to be more elaborate because it's going to replace the final examination that students undergo in India. So it's going to be more elaborate. However, once it comes, your standard for comparison remains same. That will actually tell us what is the difference between foreign medical graduates and your domestic graduates, or are at the same level. So I think next is a welcome step. And like our Honorable Prime Minister says, one nation, one examination. I also fully agree and endorse this view. And I think that will help us in many ways. And one of them is to remove this ambiguity and remove this misperception that foreign medical graduates are lesser than your domestic graduates.
But do you think that this factor is only creating the resistance in getting the next applicable?
Well, you see, I will not go into politics of this. National exit test is a part of the NMC Act, and this act has been passed by the Parliament. So I think it will be very difficult for anyone to try and get done away with it. It's not going to happen, because to do that, we have to go back to the Parliament and get this particular thing removed from the Act. So I think national exit test is here to stay. It might get delayed in implementation. People may have manipulated to delay this, but it will happen. Yes, there may be challenges because there are colleges, we all know, and National Medical Commission has been conducting surprise visits to these colleges and not finding them to be good enough. Now, people assume that in private medical colleges you have paid 1 CR fees or 1.5 CR as fees, and therefore they are bound to pass you because you have purchased your degree. That perception is going to go away with next. And maybe people feel more confident about the quality of medical education. At present, people are not confident. People are saying, are FMGs good enough? Then India, are private medical college doctors good enough? All these perceptions will be answered once and for all by applying this next examination. So I think it's a very good step, and I am very, very doubtful that this is going to be done away with. This is going to happen, albeit it might happen in 2028, but it will happen.
Great. Thank you, sir, for clearing this. Moving ahead, like you have interacted with many FMGs in your career, in your life. So what do you think what are the common struggles that they face?
Common struggles while after coming back, or common struggles they face
after coming back?
See, after coming back, the biggest challenge they face is to prove themselves. Because as you said rightly, that there is a misperception in the environment. The first challenge is to prove that they are good enough. To prove that, they make an attempt to pass FMG in the first attempt. To pass FMG, they have to get used to the clinical diseases profile and the type of questions that are being asked in India. You see, every country has a different examination system. I may be excellent in India, but I cannot say that I can go and pass USMLE in first attempt. Or let me say I can go to Russia and pass the accreditation examination in first attempt. I may not be able to pass. Same thing applies to them because the criteria on which they assess are slightly different parameters. So therefore, they have to get used to their criteria. That is one more challenge. Getting used to the criteria of assessment that is being followed in India. The third challenge is preparing to appear for your foreign medical graduate examination. Fourth challenge is getting your internship in time. Because sometimes state medical councils take a lot of time allotting seats. The fifth challenge is proving yourself during internships with your colleagues who are also doing internship from Indian medical colleges. Because you're already starting on a below zero level. So you have to now come up to 50 to 60%. So they put in more effort to come to that level. And lastly, of course, is then fighting out for the limited PG seats. So these are the challenges they are facing, and they will continue to face.
Can you suggest the way forward for them and the solution to these challenges?
See, the first solution is be confident about yourselves. Don't listen to the environment. Environment normally talks negatively. You start thinking positively. When you think positively, you do positive things. Now, what are the positive things that you're supposed to do? Do not take your MBBS studies lightly. Study from day one. Every day, take out hours, 2 hours, 3 hours to study. If you read every day, you don't have to read for an examination because you are well prepared. Medicine is one subject where diligence is more important than intelligence. Intelligence comes following diligence. We have a common saying, the eyes see not what the mind knows not. So you are a patient sitting in front of me. I have not read about your disease. I cannot diagnose you. The mind knows not. The eyes see not what the mind knows not, and the mind knows not what the eyes see not. Means if you have read about a disease but not seen it, you will forget about it soon. Until it's reinforced with repeated reading. So when you come back in your vacations, it is not vacation for you. You have to now take the theoretical knowledge and get observerships or get some training in Indian hospitals to see what is the disease profile, what is the healthcare delivery system in this country. Even in US, when you do for USMLE, they ask you to do observership or clinical rotation in US to understand their systems so that you can pass your examination more easily. Similarly, strategy they should apply. So the first strategy is study and study. And second strategy is apply your taught knowledge to the on-ground live situation when you come back to India. The third is that when you come back, you must undergo either some short courses or some, crash courses to just familiarize yourself with the examination pattern. If you do these three things, you will solve it in first attempt.
Thank you, sir, for these excellent tips. Sir, other than these tips, do you think the mentorship and the coachings can help in bridging this gap?
Absolutely. You see, mentorship is very, very important because mentorship encourages them, makes them feel more confident, and then guides them how to read, from where to read, and what all to read. Because medicine is a vast subject. So, what is important? What you must know, what you should know, what you may know. There are three things. So they must be able to differentiate that what you should know, what you may know, and what you may just like to just read. So if you know all these, then you are more at ease while preparing. You will not focus on mundane and more complicated subject because people always feel in examination complicated questions will be asked. And you focus on those fine print and you forget the basics. But in examination, more commonly questions related to basics are asked. The uncommon questions are rarely asked, and common questions are commonly asked. So this is how mentorship will help them to focus on those common questions, guide them on the way to study in a smart manner, make them build confidence, and encourage them down the line that you are good enough. So if you do mentor them correctly, they feel more confident in attempting the questions in the examination and they are less stressed. So this is the role of mentoring. Now coming to coaching. What coaching offers you? Coaching is no substitute for your basic knowledge. So you have to read your books anyway. But if you read your books and have come prepared, then coaching tells you where to focus more, and coaching tells you the layout of the examinations and how to address the questions, how to utilize the time given to you and to answer those questions in that allotted time.
The time management, the exam pattern.
Exactly, examination pattern. And it also lets you know where are your gaps. It helps you to identify your gaps, build upon your strengths and eliminate your weaknesses.
Okay, thank you, sir. Moving ahead, what do you think? What role can Indian medical institutions or the universities or the colleges can play in support of these FMGs?
You see, this is very, very important, because medical institutions in India can play a very active role in not only granting them access to their facilities, but also helping them to build up upon their clinical competencies, making them aware of the disease profile in this country, and giving them exposure to what the Indian healthcare delivery system is all about. So you have all these things, they come into Indian institutions. Now what are the Indian institutions which can help them? There are medical colleges, there are hospitals, healthcare institutions, there are postgraduate teaching hospitals. Actually speaking, in my opinion, if really the National Medical Commission wants to absorb these foreign medical graduates, they should allow them to come back, and compulsorily, mandatory it should be for them to attend some clinical experience workshops in these medical colleges and in hospitals. They are our people. They have gone abroad because we could not accommodate them. So it is our responsibility to help them. Actually speaking, National Medical Commission should take initiative. They should take them as our students, Indian students who want to come back and practice. It is brain gain.
Right.
We have spent foreign currency. Now that foreign currency which is spent on them, that thing should be reutilized by us in terms of these brains that are coming back to us. Somebody else has trained them. So let us utilize them and let us put them, make them comfortable, put them in these institutions, let them train them for 3 months, which should be mandatory. If they get trained, they don't need coaching. They will be able to address any questions. And I think whatever little deficiencies are there in the clinical competencies, they'll be overcome in this 3 months.
I think, sir, this answer of yours answers to my next question that I was going to ask you. It is like, what change would you be doing if you get a chance to redesign the FMG? So I think this answer implies to that as well.
I want to do that. And I really want our government, our Ministry of Health and Family Welfare, National Medical Commission, National Board of Examination to take these initiatives. I said, don't discard them. Don't treat them as lesser human beings. They are part and parcel of us. They are a part of those people who are going to contribute to the healthcare delivery system of our own country. And they want to come back and serve the country. So we should make policies in which they are more easily accepted. Remove the taboo of this foreign medical graduates. Say they are Indian citizens who have come back to us. They have taken pride in coming back to us. We are proud of them. But to make them come to the level where we expect them to be, we are hereby giving this opportunity of having a 3 months course, refresher course, where you will learn additional clinical competencies that are expected of you while serving the Indian population.
Right.
So this is one change. Second change is the foreign medical graduate examination today. I do not know how the questions are made. I remember that some time back we were given this task when I was in Armed Forces Medical College. So every department made certain questions, administered those questions to recently postgraduate students who had just joined as residents, and those which everybody answered correctly, they were compiled and they were sent. I don't know how it is being done now, how the question bank is being generated, but in my opinion, every medical college, every department should be asked to make a question bank, give it to your interns who have just passed out from MBBS. Those questions which almost 80 to 100% answer, they can be labeled as easy questions. Those 60 to 80% who they answer, they can use a moderate difficulty question. And those which are asked for answered by less than 50% may be labeled as difficult questions. And then you make a question bank where you have at least 60 to 70% questions which are easy questions, and then make relative level of difficulties. So that if you are not knowing easy questions which are basic for treating any patients, then those questions if you cannot answer don't deserve to pass.
Right.
But we are making it, the paper is such, like this time I got the feedback that this time the question paper of FMGE was from moderate to difficult.
It was like people were saying that it was of the level of PG.
People said the NEET PG was easy to moderate, and
FMGE was moderate to difficult.
That is being unfair. Now I don't blame the people who set the paper, because you are setting a standard paper for everybody. But I think that if you classify your questions like this, that easy question, basic question should be 60%. So you got adequate chance to pass. Remaining 40% of relative level of difficulty. So you are starting from the premise that we want to pass everybody. If you fail, it is your responsibility. I think the paper should be made in that pattern. That is my second suggestion, that how we can actually bring these people into our own systems.
Everybody watching this must be wishing that NBE hears this. So taking this to end, what message would you like to give to the parents of these students, foreign medical graduates who are struggling to pass this examination?
Yes, I think the most affected are the parents. My first thing is, I'm a very strong believer of what Winston Churchill said once. Winston Churchill was asked to come and speak on the stage in his alma mater, that what lesson would you like to give to the audience? So he got up, he went to the stage, took out a piece of paper from his pocket and read one thing. Try again, and sat down. That was the only message he gave to the audience. And this is the message I would like to give the parents. Don't get demoralized or demotivated. Don't start cursing your child just because he's not able to pass FMG. Encourage him, tell him to try harder, tell him to try smarter, getting some additional assistance. If you have some contacts, or you come to your consultants, your organization through which you have gone, approach them, get them to do some clinical practice in some of the hospitals. Get the coaching to decide what are the weaknesses of the child and try to overcome the weaknesses of these students. They have passed their MBBS examination in a foreign university. So they are already there. Probably they do not know how to study smart. So get them to study smart. And second thing they're lacking is confidence. Give them that confidence, but never despair. Never accuse him, never blame him. He will come good one day.
Thank you so much, sir, for this suggestion, this piece of advice. It is, I think, very, very valuable for all the parents. As parents are struggling hard, students are, but parents are struggling harder, I will say. And thank you for joining us today and for shedding the light over this FMG results and what the future holds for our foreign medical graduates. Thank you so much.
Thank you, Priya. Thank you very much.